your risk of heart attack is increased by lack of this mineral. Magnesium has a role in more than 300 different metabolic processes, including those that control blood sugar levels, produce proteins, and manage blood pressure. Health issues like high blood pressure, high cholesterol, type 2 diabetes, coronary artery disease, and sudden cardiac death have all been linked to low magnesium levels. A healthy adult has about 25 grams of magnesium in their body, of which 50 to 60% is stored in their bones and the majority in their soft tissues. Despite being such a crucial component, research reveals that a sizable portion of Americans do not consume enough magnesium. Magnesium is very closely controlled, so your body only releases it from your muscles and bones whenever your blood levels drop. Because of this, blood tests for this micronutrient are not very reliable, because you can have very little magnesium in your body and still have normal serum levels of magnesium. How does magnesium impact the condition of your heart? The heart and circulatory system experiences numerous advantages from having normal magnesium levels. Ion transport channels in the muscle cells of your heart and blood vessels carry ions like sodium, potassium, and calcium into and out of cells to cause muscular contractions. Magnesium is required for the functioning of this ion pump and aids in maintaining a regular heartbeat. A lack of magnesium results in irregular heart rhythms, arrhythmias, which can occasionally be fatal. Both magnesium and calcium compete for many of the same ion transport channels. A lack of magnesium results in a buildup of calcium, which in turn induces heart and blood vessel spasms and may raise blood pressure. Magnesium also helps the heart and blood vessels to relax while lowering the quantity of calcium in the cells, which lowers blood pressure. One study has found that individuals taking magnesium, an average of 368 milligrams a day, experienced a modest drop in blood pressure. Magnesium aids in the release of insulin by the pancreas and the removal of glucose from the bloodstream, which controls the overall level of glucose in the blood. Type 2 diabetes is less likely to develop in those whose diets contain more magnesium. Unfortunately, heart disease is recognized to be at risk in those with diabetes. Magnesium has a number of potential mechanisms for lowering the risk of heart disease. One approach is through its antioxidant and anti-inflammatory properties. A magnesium shortage worsens atherosclerosis, cholesterol deposits in the coronary blood vessels and inflammation that damages blood vessel walls. Another method magnesium protects your heart is by reducing platelet clumping and clotting, which occurs after a heart attack or stroke. Magnesium deficiency has been linked to an increased risk of cardiovascular disease and heart attacks. Aside from all of the ways magnesium can potentially enhance your heart health, it can also help with other problems. According to studies, some patients with migraines have insufficient magnesium levels. Serotonin and N-methyl-D-aspartate, NMDA, receptors, two receptors in the brain pathways that can cause headaches, are affected by magnesium. One study found that taking extra magnesium led to a reduction in migraine frequency and an improvement in migraine symptoms. The Academy of Neurology and American Headache Society state that magnesium supplementation is beneficial for preventing migraines. Magnesium interacts with the brain chemicals, neurotransmitters, NMDA and gamma-aminobutyric acid, GABA, both of which play a significant role in the regulation of sleep. Although it's unclear how magnesium impacts sleep, a study found that taking magnesium supplements led to subjectively shorter wake times and higher sleep duration. Magnesium influences brain chemistry through neurotransmitters, which also helps alleviate the symptoms of depression. Studies have linked a lack of magnesium to depression, and several have found that depression improves when magnesium supplements are taken. According to studies, women who have osteoporosis have lower magnesium. According to one small study, postmenopausal women who took magnesium supplements had lower bone turnover, which equates to lower bone loss. According to dietary studies of Americans, 50% of those between the ages of 19 and 50 do not consume enough magnesium to meet their estimated daily needs. If you only consider those over the age of 71, this percentage rises to 70 to 80%. For men, the recommended daily allowance is 400 to 420 milligrams, whereas for women it is 310 to 320 milligrams. Magnesium can be found in a wide variety of foods, particularly whole grains, legumes, green leafy vegetables, and nuts and seeds. The majority of foods high in fiber, as well as fortified foods like morning cereal and bottled water, are also high in magnesium. Here is a list of some foods high in magnesium: pumpkin seeds, chia seeds, almonds, spinach, cashews, peanuts, soy milk, rolled oats, bread, whole wheat, avocado, brown rice, and milk. You can take supplements if your diet does not provide you with adequate magnesium. Because the kidneys control how much magnesium is expelled in the urine when levels are low, healthy persons typically do not experience symptoms of low magnesium levels even though the majority of Americans do not consume enough of it. However, a magnesium deficit, otherwise known as hypomagnesemia, can occur in older adults, those with type 2 diabetes, Crohn's disease, alcoholism, and other medical problems. In its early stages, hypomagnesemia can result in an appetite loss, nausea, vomiting, exhaustion, and weakness. To get the widest range of health benefits from magnesium, you should aim to receive the majority of your recommended daily intake through your food. Be sure to like, subscribe, and hit the notification bell to get more videos like this one.